Together we achieve victory over heart failure.
Hello, friends. Today I will be talking to you on heart failure. Topic I say is triumph on heart failure. Actually, at present we are far from it because heart failure remains a major medical problem despite the various advances made in the treatment of heart failure in recent times. In fact, it is more dreadful than cancer throughout the world. Now, throughout the world, there are more than 26 million people suffer from heart failure. And cancer can be cured. At least some of the cancers can be cured, especially if detected in time. Whereas in the case of heart failure, once it is diagnosed, there is no cure for it. Even with the best possible treatment, you could only control the symptoms and have a reasonably improved quality of life. And also, it has to be remembered that only 50% of people survive beyond 5 years once a diagnosis is made. It is important to remember that the mortality from cardiovascular disease has come down in many countries in recent times. But even then, the mortality due to heart failure, as well as the rate of admissions and readmissions with heart failure has only gone up in recent times. This is especially the case under the age of 65. In fact, as I said earlier, heart failure is more dreadful than cancer because cancer can be cured, at least some of them, whereas there is no cure for heart failure once it is developed. There are different stages for heart failure. In stage A, there are only risk factors for heart failure. In stage B, in addition to the risk factors, there may be structural or functional abnormality of the heart, though there are no symptoms of heart failure. In stage C, the patients would have symptoms of heart failure, and stage D means that patient is in severe heart failure. In recent times, we have seen the development of many useful drugs. These drugs have actually helped us to manage heart failure, whether it is acute or chronic heart failure, and improve the quality of life in many patients. But even then, as I mentioned earlier, only 50% of patients, even with the best possible medical treatment, survive beyond 5 years. Even though these drugs are helpful in improving the quality of life as well as the life expectancy, in a large number of patients do not respond to even the best possible medical treatment called optimal medical treatment. And some of them are benefited by the what is called device therapies and heart transplantation. But only a small minority will be benefited by this for various logistic reasons. So the treatment of heart failure remains rather dismal, and the only way to tackle this problem at present is to introduce effective measures of prevention. So when you consider prevention, we have to think about the risk factors of heart failure. Only if we know about the risk factors of heart failure, we will be able to implement effective means of prevention. The risk factors are, the traditional risk factors are smoking, not having adequate exercise, having unhealthy food habits, high blood pressure, diabetes, high cholesterol levels, and high stress in life. By managing or preventing these risk factors, it is possible for us to prevent patients from developing the heart failure even at the early stage. Once they have developed stage B, that is, patients have structural or functional abnormality of the heart, either in ECG or events in echocardiography, they may need even more effective measures, and that include certain drugs. These drugs have shown to be very effective to some extent in preventing heart failure. One of the most important drugs is SGLT2, sodium glucose co-transporter T2 inhibitor. It's actually anti-diabetic tablet, anti-diabetic medicine. There are different molecules are available. Empagliflozin, dapagliflozin. There are many are available, but it is now shown that even in the absence of diabetes, these drugs can help to prevent heart failure. And it is stated that it is almost equal to statins in coronary artery disease. Statins are proven to be very effective in preventing coronary artery disease, both in primary and secondary prevention. And the SGLT2 inhibitors have the same status in prevention of heart failure. Patients who have developed coronary artery disease should be given ACE inhibitors or angiotensin receptor blockers and beta blockers to prevent heart failure. There should be very aggressive management of high blood pressure. The high blood pressure at any age should be kept at 130/80. Same thing applies to diabetes. The diabetes should be managed very effectively, and the HbA1c, that is the average blood sugar over 3 months, should be kept below 7%. Along with that, regular exercise, regular optimal exercise, a heart healthy diet, including functional food, which help to prevent heart diseases, would go a long way in preventing heart failure. Once any of the conditions that can predispose to heart failure are diagnosed, like coronary artery disease, hypertension, or valvular heart disease, the effective management of these conditions would also prevent heart failure. Thank you very much.